Nurses are not slaves. Nursing is the aspect of the healthcare sector that focuses on caring for individuals, families, and communities so they may recover, maintain, or attain optimal health and quality of life. Nurses differ from other healthcare providers by their approach to patient care, training, and scope of practice. They may work hand in hand with physicians and therapists to provide care to patients or independently as nursing professionals. The tasks performed by nurses vary by specialization or unit. Nurses provide and monitor patient care, educate and advise patients and family members about health conditions, provide medications, treatments, and emotional support to patients. They also work with healthy people by providing preventive healthcare and wellness information. Although most nurses work in hospitals, some may be employed by schools, private clinics, nursing homes, placement agencies, businesses, prisons, military bases, or other employers. In recent times, studies have indicated that healthcare workers, especially nurses, face a high risk of abuse in the line of duty. These abuses range from physical to emotional and psychological abuse. In Nigeria, the plight of some nurses is a sad one. Pride and integrity for the profession are gradually being lost, and many enter the profession without a clear sense of their worth. Far too frequently, nurses are mistreated, underpaid, or not paid at all for services rendered. They also experience verbal and in some cases physical abuse or violence from their patients or patients' families. Nurses often suffer these mistreatments for a number of reasons. One of such reasons is that they are typically the healthcare professionals that have the most direct contact with patients. In hospitals, they work around the clock, so they are with patients and families when they hit low points. In spite of this, these incidents are demeaning and as such should not be tolerated in the healthcare settings. Nurses are professionals and should be treated with decency, self-respect, and professionalism they deserve. In some parts of the globe, there are healthcare organizations actively working to reduce verbal and physical violence against healthcare givers. Stiffer penalties are being put in place for anyone who would assault a nurse or other emergency medical personnel. These structures should be adopted in the Nigerian healthcare settings. Establishing a system to report any patients whose behavior causes concern or who displays violent traits towards healthcare givers would go a long way to curbing the trend. Nurses are not slaves and should be paid a fair wage. They deserve to be treated with respect and not exploited by senior colleagues, patients, and their relatives.